Salina Regional is happy to announce a new tool in the diagnosis of lung cancer, the Ion Robotic-Bronchoscopy. My name is Dr. Cedano, Pulmonary and Critical Care Medicine.
Well, Dr. Cedano, thank you so much for coming back to the show. We're going to be talking about a very exciting new technology, the Ion Robotic-Bronchoscopy. Why don't you talk about why it's so important?
Lung cancer is the third most common cancer in the United States. However, it's the more deadliest cancer. I just want to put some numbers there. 600,000 people died of cancer last year in the US, with 125,000 being caused by lung cancer. That's 3 times more than colon cancer. The main problem that we have with lung cancer right now is that our rates of screening are very low. For example, in Kansas, we only screen 6 to 7%, and that's like kind of average all the way through the US. That's why lung screening becomes so important, is because we can find people with cancer in early stages, and that impacts their survival. For example, if you're diagnosed as stage 1, your chances of survival over 5 years are like 88 to 92%, while if you go down to stage 3 or stage 4, your chances of survival drop to 36 to 10% in 5 years. So having that in mind, that's why catching the cancers early is so important, and that's where the Ion robotic bronchoscopy comes in. This new technology is basically minimally invasive biopsy, and what the robot allowed us to do is basically guide us like a GPS, telling us where exactly to go in the lung, and when we get there we can verify that we're in the right spot, and we can take biopsies, cultures, take a lot of tissue, so we can send it and get a diagnosis. The good thing about this is that we can diagnose a small nodules. So for example, 6 millimeters and up, we can probably will get it, and also we can go to other areas of the lung that were not reachable before. You
kind of mentioned some of them, but what are the advantages of using the robot?
So I will talk about 3 advantages that I think are the most important ones. First, it's an ambulatory procedure, like I was saying, so you go home the same day without any limitations. The second advantage that I think make it a very safe and precise procedure for biopsy of the lung. So the third advantage is that it's very precise, and we also have a pathologist in the room with us. They can check in real time what we're biopsying, so we know we're getting the nodule, and this helps us a lot increasing the yield of finding the right diagnosis for you.
Well, thank you so much for some great information, and thank you for watching. For more information, you may visit salinaregionalpulmonology.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.